This video is about an acute coagulation disorder named as Disseminated Intravascular Coagulation. Disseminated intravascular coagulation is a widespread disorder with a combination of thrombosis and hemorrhage. And the etiology. The major disorder associated with the disseminated intravascular coagulation include several infections, obstetric complications, neoplasm, etc. The infections include gram-negative bacterial sepsis. Also, meningococcemia and other bacteria contributed to DIC. Funky viruses, Rocky Mountain spotted fever, malaria are also associated with this disease. And then, obstetric complications like retained dead fetus, septic abortion, abruptio placenta, amniotic fluid embolism, and toxemia and preeclampsia. Then, neoplasm associated with the DIC include carcinoma of pancreas, prostate, lung, and stomach. Also, acute promyelocytic leukemia. Then, massive tissue injury like trauma, burns, fat embolism, and surgery also associated with DIC. Then, vascular disorder like aortic aneurysm and giant hemangioma. Then, immunological reactions include transfusion reaction and transplant rejection reactions. Also, respiratory distress syndrome is associated with the DIC. The miscellaneous conditions associated with the DIC include snakebite, liver disease, acute intravascular hemolysis, shock, heat stroke, and hypersensitivity, also vasculitis. Then, pathogenesis. DIC is a disorder that shows a combination of thrombosis and hemorrhages. The two major mechanisms initiate the thrombotic process of DIC, namely the entry of procoagulant or the thromboplastic substances into the circulation and widespread endothelial injury. The entry of procoagulant or the thromboplastic substance into the circulation, which activate the coagulation system, and the widespread endothelial injury exposes the thrombogenic subendothelial matrix. So, the both procoagulant substance and the endothelial injury activate coagulation system, resulting in fibrin platelet thrombi formation in the microvasculature. Then, consequence of thrombi formation, which include thrombotic occlusion of the microvasculature of all organs, which leads to ischemic tissue necrosis with the organ dysfunction. Then, trapped RBCs in the thrombi undergo fragmentation. This RBC appears as schistocytes in the blood smear, but frank hemolytic anemia is unusual in DIC. So we get microangiopathic hemolytic anemia. Then activation of secondary fibrinolysis, which leads to fibrin degradation products, and which is a cause of bleeding. Also, consumption of the coagulation factors and thrombocytopenia occurs as a consequence of DIC, and which leads to bleeding. Then about clinical features. It is serious, often fatal clinical condition, and the signs and symptoms are related to hemorrhagic diathesis or bleeding, also microvascular thrombi. The hemorrhagic diathesis is most common, manifest as ecchymosis, petechial rashes, or bleeding from mucous membrane or at the site of vinipector. Then the microvascular thrombi, which leads to tissue hypoxia and infection of organs, leading to multi-organ failure. Then about lab diagnosis. Here the screening assays include coagulation abnormality detection like activated partial thromboplastin time increase, then prothrombin times also increase, then we get thromboplastin time also increase, and the fibrogen count is decreased. Bleeding time and platelet count are also decreased. And in the peripheral smear, microangiopathic hemolytic anemia with schistocytes are observed. Then confirmatory test. It includes fibrinolysis abnormalities detections and the fibrin degradation product, which is very important. The secondary fibrinolysis result in generation of FDBs, which can be measured by latex agglutination. Then D-dimer test is specific for the diagnosis of DIC.